If glomerular filtration is driven by pressure, all right, let's look at what some of those pressures are, because we're going to start moving factors around and seeing how things change in a minute. Okay, so we made our glomerulus even simpler. We have our afferent arteriole, our efferent arteriole. Here's our glomerulus, all right? We have, remember, we have blood. We'll put the arrows in. Blood coming in this way, going out that way from the heart. Okay, these two valves, the afferent and efferent arteriole, can be affected independently of one another. Okay, so we have two valves in this system. Okay, so we'll just start. We've got capillary hydrostatic pressure that's coming in, right, from the heart. Well, we're going to give that a fancy name. We're going to call it glomerular hydrostatic pressure, also called glomerular capillary hydrostatic pressure. It is the very same pressure that we talked about when we talked about the Starling forces, right? So just like at every other capillary bed, you have a capillary hydrostatic pressure, same thing. We're just giving it a fancy name because we're in the glomerulus. Okay, so that's an outbound pressure. That's going to have a tendency to push filtrate out of the glomerulus and into the capsule. Now, we also have glomerular colloid osmotic pressure, just like we have blood colloid osmotic pressure. Same thing. It still is blood. It still is going to have a pulling pressure. So that's going to be an inbound pressure from the solute that's passing through the blood. Then we have the capsule, okay? Bowman's capsule is not very stretchy. It's not very compliant. So the more fluid you put into it, the higher the pressure gets, okay? So it means we have to account for the Bowman's capsule hydrostatic pressure as well. So it is pushing opposite glomerular hydrostatic pressure, right? So the heart's trying to push fluid out. The capsule is restricting fluid movement, so it's pushing back. So if we line up our ins and outs, we can come up with a net filtration pressure, just like we did in the Starling forces, right? So our glomerular hydrostatic pressure minus our Bowman's capsule pressure minus our glomerular oncotic pressure gives us our net filtration pressure. Okay, so this is the amount of pressure, all told, all summed up, this is the amount of pressure that's pushing fluid into Bowman's capsule. This net filtration pressure is what's driving glomerular filtration, okay? Because that's the pressure behind the filter, is the net filtration pressure. All right, so obviously these things change, okay? So these are our factors initially, but glomerular hydrostatic pressure in here, is going to increase and decrease with blood pressure. You know, we've been talking about how blood pressure changes, you know, all throughout the day, small changes. Well, when the blood pressure of the body changes, we're going to have either more or less pressure into the glomerulus, and that's going to affect this factor. The glomerular hydrostatic pressure is going to vary according to blood pressure. The blood colloid osmotic pressure, the Bowman's capsule pressure, it can be modified by disease states. So imagine that your collecting system at the end of the nephron is blocked somehow. So fluid can't get out. Well, that pressure is going to back up into Bowman's capsule, and then the Bowman's capsule pressure is going to get higher than the glomerular pressure, and we'll lose GFR in that nephron, right? So Bowman's capsule pressure can change because of obstruction. And then glomerular colloid osmotic pressure can change with changes in the plasma proteins or the osmolarity, right? So I ask a question, what would mannitol do? You probably don't know what mannitol is. Mannitol is a sugar that isn't absorbed into the body. So it basically, it acts like an osmotic pull, right? It acts like protein, only it doesn't have any effect. So if we put mannitol into a patient, it has a tendency to increase the blood colloid osmotic pressure. So all over the body, fluid gets slurped into the vessels, right? So it's actually a way of getting rid of edema. So in our case here, what would mannitol do to GFR? Well, if we increase this factor, we're going to end up reducing our net filtration pressure, right? So all of these things, as you're getting used to in this class, all interrelate, right? They're all related to one another. Now, another interesting feature is, as natural blood comes in here, right? And blood minus filtrate comes out here, okay? I think that makes sense. Why? Because filtration happened. Well, the more filtrate we get leaving, the less water is left behind, all right? So it means that as we go from the beginning of the glomerulus to the end, our glomerular colloid osmotic pressure actually increases across the glomerulus because a bunch of water is leaving, right? So if we push the water out, the solute is left behind and it's getting higher and higher osmolarity. So it's pulling more and more. Okay, so those are all features that are happening all the time. And what we get into next is how does the body address that, okay? Because these things are variables. But in the cardiovascular system, I talked about how the body defends a blood pressure, right? In the kidney will defend a glomerular filtration rate. Like that is what it's going to defend. It's going to work its magic around keeping the GFR where it needs to be for the body's needs, okay? All right, so let's get to talking about these valves. All right, so we have an afferent arteriole and an efferent arteriole. Both can constrict or relax, right? We have our inbound pressure and we have our glomerular capsule pressure, right? Our glomerular hydrostatic pressure, glomerular hydrostatic pressure. Okay, so let's look at a very simple change, okay? If we constrict the afferent arteriole, okay, the inbound arteriole, how will that affect capillary hydrostatic pressure here? Okay, well, if we have an increase in resistance between here and here, we will have less blood flow, less pressure moving through, so we'll have a decrease in glomerular pressure, right? So vasoconstriction of the afferent arteriole causes a decrease in both GFR and glomerular capsule pressure, okay? We see that over here, okay? So this is afferent arteriolar resistance on the x-axis, glomerular filtration or renal blood flow on the y-axis. We can see that as arteriolar resistance, in other words, vasoconstriction, right? As this vessel gets smaller and smaller, glomerular filtration gets smaller and smaller, right? We can also see that as arteriolar resistance increases, in other words, as the afferent arteriole constricts, renal blood flow is reduced. This is the very same thing you would have seen in any capillary bed in the body, right? In some ways, we've already talked about this. The only difference is what is causing the constriction, right? We haven't talked about CO2 and oxygen and pH and all that, right? So it's a different cause, but the same thing is happening. If we constrict the arteriole, we get a reduction in blood flow and a reduction in pressure and therefore a reduction in GFR. Okay, so that's the afferent side. The efferent side, I think, is a little harder to understand because we have essentially two different effects that stack on one another. Okay, so let's say we're leaving the afferent arteriole alone and we're just going to change the efferent, the outbound arteriole, okay? Well, if we constrict the efferent arteriole, for the same renal plasma flow coming in, we have a restriction to its exit, right? So that's going to increase the pressure in front of this resistance. Do you see that? So if we restrict here, we're going to have less pressure leaving and therefore more pressure here. So when we constrict the efferent arteriole, modestly, okay, and that's where this gets complicated, but if we constricted a reasonable amount, we get an increase in glomerular pressure and therefore an increase in GFR. Now, this is the graph that we're talking about, and you can see that it's not linear. We have this other relationship here. And the way to understand that is like this. Eventually, if you make this tight enough, you're going to restrict the flow here, right? Because you've got a lot of resistance across the whole circuit. So if you constrict the efferent arteriole enough, you'll start to get a reduction in flow through the system, even though you have an increase in pressure. So we see that as this curved line right here, that as efferent arteriolar resistance increases, okay, that's here. First, what we see is an increase in glomerular filtration as the pressure in the glomerulus goes up. But as we keep increasing the vasoconstriction, that increase in GFR starts to fall off because of the reduction in renal blood flow that's flowing through the whole thing. Okay, so the efferent is a little more complicated than the afferent. Now, what really makes this interesting is both are happening at the same time. All right, so it means that you have changes both to the inbound flow and to the outbound flow. I like analogies. These concepts are hard, and I think they can be difficult to conceptualize. As strange as this analogy is, it works for me. Imagine that you've got a garden hose, right? You've got it hooked up to the house. You've got a valve in it, right? You attach a sprinkler, the good old-fashioned kind that go like this, right? Okay, so simple step, top one. If we open the valve from the house, we'll get a nice tall sprinkler, right? If we close the valve to the house, the sprinkler will get smaller. That's the top graph, okay? Now, we're going to make it more complicated in the second graph because we're going to add another valve downstream of the sprinkler, right? So hose, house, sprinkler, valve, okay? Now, if we open the valve to the house, okay, now we get a nice sprinkler. Well, what if we open the valve on the other side of the sprinkler? Now all the water goes out on the grass and the sprinkler falls, right? If we close that valve, it goes all the way up. Now, what I can't do, what my analogy doesn't account for is the flip, right? Because our valve, you can never overcome the pressure from the plumbing department, right? So that never happens. But it's the same idea. You've got two valves. You can control how high the sprinkler goes, in other words, what your glomerular filtration rate is, by adjusting either the inbound or the outbound or both, right? So it gives you options. That's essentially this glomerular filtration. And remember, in these diagrams, the pressure in the glomerulus, that's the sum of all of these pressures, right? So we've taken this and simplified it into just net filtration pressure. All right, so afferent and efferent arterioles can and do affect GFR. GFR is what the kidneys are going to defend.